Hi everyone, Wynn Brown here with the Wednesday, March 18th evening edition COVID-19 update for the Haywood healthcare family. So I have some updates for you. I know first off is people want to know how are we doing on testing. To date we have tested 32 patients. We have 14 negative results back and no positives at this point in time, so that's good news for us. The turnaround time does seem to be improving as time goes on, so we feel much better about that. Just a couple updates on our campus. The UMass Specialty Clinic on the Haywood campus is closed, and that's neuro and endocrinology, and so the UMass specialists are not seeing patients here right now. Also, dermatology of Leominster, which is in our medical office building on the Haywood campus, is closed for a couple weeks as well. As you know, we have a shortage across the country and here at Haywood on PPE. Personal protective equipment, and I just want to thank a couple of local companies. As you know, we're not the only industry that uses PPE, and Whips Inc. in Athol and Brian's Auto Body in Gardner both donated N95 masks for us that they had in stock to help us, so that is really a fantastic way for our local businesses to step up and support us, and I appreciate that. Also, Ken Tomasetti of Advanced Cable Ties in Gardner, who's just a great community supporter, has continued to help he and his staff with our weekend backpack food program that we run. So a shout out to Advanced Cable Ties as well. Caring for Colleagues, I mentioned we're going to kick off a fundraiser for that fund, which is Keep Calm and Wash Your Hands, with a little British look going. As soon as we get that set up, I'll let you know. Maybe I'll have one to wear tomorrow. I didn't see them floating around today. A lot of questions about how do I get tested for COVID-19, and so I'm going to explain the process to you. So if you have the signs or symptoms of the flu or flu-like symptoms, the first thing you can do is call your primary care physician and get triaged by them to decide and screened by them to see whether or not you need to be tested. We have two testing sites, one at Tully Walk-In Care in Athol and Haywood Urgent Care here in Gardner. You would present yourself, you get screened at the door, and then you will be, if you have signs and symptoms, you will be checked in by a medical assistant in the practice. Physician or advanced practice provider will do an H&P, a history and physical with you, an assessment. If it is deemed that you do need testing, we have testing tents set up outside behind those facilities. You will first be tested for the flu A and B, and if you rule in for A or B, you'll get medication if it's appropriate and sent home. If you test negative, you might have further workup. You might have pneumonia, and so you need an X-ray, which we can do on site, and/or you might end up getting tested for COVID-19, which is a nasal pharyngeal swab that we would do on you. That would also be done in the tent. You would then be sent home, and then when we get the results would be called in from one of those two sites that you went to. The information will also go to your primary care physician, and so we're just making certain that, and if you go to the ER and have it done in the ER, all of that will be called back to you. We're just making sure that multiple providers call you so that we cover all our bases, and that's really the process we have it right now. If you don't have any flu-like symptoms, please don't show up at urgent care. If you have no need to go there, if you're walking well, that's where it goes. If you're the general public, then those are the people asking questions. We have a process here with our occupational medicine if you're an employee here who has signs and symptoms as well. So that's our report for tonight, Wednesday, March 18th. I'll be back to you tomorrow morning, probably upload the video around 11 for you all to see, and we'll let you know how things went overnight. So have a great evening. Appreciate again everything everybody's doing to take care of each other and our community and on our journey to be one of the best community-owned health systems in America. Thank you very much and good night.